Hey everyone, it's Dan and Don from theclinicaltrialsguru.com. We've got asked a very interesting question, and it's been going around on the web a lot. There's been a lot of discussions about this particular topic, and it's about the pros and cons of being anonymous online. Now, are there pros and cons for being anonymous as a patient or someone seeking medical information? Obviously, there could be some benefits. If you don't want other people to know what kind of information you're seeking, it's very understandable to be anonymous. Now, if you're a healthcare provider providing information online, let's say a blogger or someone on Twitter, how important is it to remain anonymous or just let people know who you are? Do you gain more credibility by letting people know who you are? Or is it ever appropriate for a healthcare professional to remain anonymous online?
I think that it may not be a good idea for the healthcare professional to remain anonymous, because the whole key to building a rapport with people out there is trust. And I know for me that if I'm getting this information from a source and I'm not sure who it's coming from, it puts the whole thing to question.
Mm-hmm. And for the patient, if you're a patient and seeking information online, it's very understandable if someone wants to remain anonymous when they're seeking information on STDs or things like that may be frowned upon,
right,
by their friends or someone who may see it, like a family member. It's understandable. But what about things like diabetes or something like that, like depression or arthritis, asthma? Is it ever appropriate for a patient to be anonymous online?
I think again too that comes down to the individual. I can understand wanting to keep your identity hidden as a patient, because just like everything else too. You may not want people to know that you have certain illnesses. You may not want someone to know that you're going to see a doctor about certain things, and I think that plays the same way on the internet. That's why some of our previous videos where we've interviewed people who have participated in studies or were in studies, they stayed off camera and just referred to themselves through acronyms, just so that they can maintain that anonymity and not have anyone point out and say, hey, yeah, I saw you and you're such and such, and you have this illness. It's a personal thing.
Yeah, now what about someone who's been in a clinical trial and he's on Facebook posting, I just went to this study and earned all this money. Is that appropriate for him to do? Obviously he's got the right to do that. Should we encourage more people to post that they've joined a study and maybe discuss their experiences in a somewhat public fashion? Or should that kind of stuff be kept confidential? These are questions that, no one has a right or wrong answer. It's just up to the individual. But it's definitely issues that we're going to have to address as people get more comfortable using the internet for communicating.
I agree.
So just something to keep in mind, and it does relate to clinical trials, because clinical trials, we often like to keep things very private. The drug companies like to keep all that stuff kind of quiet. Even if you had a good experience in a study, they don't want you to mention that you did one of their studies. For instance, they're not going to want you to say, oh yeah, I just did a study with Novartis.
Right.
It was great, and I have asthma. People can be able to find out what study they did, and it's understandable that these drug companies would get scared.
Yeah.
And that's on the good experiences. Imagine on the bad ones.
Right, and I understand that too, because you want to make sure that they want to make sure they get these medications through and that there's no complications on trying to get their approval. There's a lot at stake there when they're going through this process. But on the other hand, I think it's okay if someone got on and say, hey, I went through clinical trials for cancer or diabetes or schizophrenia or whatever, and it was a great experience. Here's what my experience was. You ought to try it. Or I can say, hey, I didn't have such a good experience over here, and I don't recommend this, or I don't recommend this place, or whatever, and you can contact that individual for that place. I think it's up to the individual.
Right. And regardless of whether we think it's right or wrong, or yes or no, or is it appropriate or not, people are gonna discuss these things anonymously or very publicly, depending on that person. So there's no right or wrong answer. It's just something that we're going to have to get used to.
And I think that's been a problem, is a lot of, just like even what Dan and I are doing right now, bringing us this information to you, creating this forum. There's a lot of places, and I've talked to people at other investigational sites, and large investigational sites, where they're afraid to do what we're doing. They're afraid that if they say the wrong thing, or somebody says the wrong thing, then somebody's going to come back and sue them. And
yeah, good point. Talk a little bit about that without mentioning names, because I didn't think about that when we were going to shoot this video. People in the industry always ask us, you know, because they say, "Hey Don," or "Hey Dan, we've seen you online. What are you guys trying to do? You guys are putting yourselves out there. You talk about what company you work for, which is South Coast Clinical Trials, by the way. Aren't you afraid of doing this?" You get that a lot, right?
We've gotten that. The thing about it is that you can't be afraid. Number one, we're not saying anything wrong. We're making sure that we're not crossing any boundaries with anyone. Anybody that we do talk to, we have their permission to speak with them. Obviously, you can see that if they're going to be on camera, they're giving us permission to do it. The whole purpose here is to bring awareness about clinical research, and that's for all of us, from the professional down to the potential patients or subjects. In this case, I don't like using the term patients, I like using the term subject. And it's a place where we can come and grow in knowledge, because the professional can learn from the subjects on what the subjects are looking for and their perspective on what's going on. And the subjects can also learn from the professionals on exactly what they expect and how they're introducing these studies to them out there.
Right.
So it becomes a win-win for everyone, and it goes back to why we started this whole thing, and that was this whole blogging, and that was because people were trying to get information about research, but all they were getting is routed to somebody trying to recruit them in a study. And what happens is that they're either forced into a study, then you got retention issues, or they just don't follow through at all and they don't go because they didn't get any information, and they're not comfortable going into a study if they don't know what it's about.
And speaking of anonymity, you know, online, remember we had a monitor that we were going to interview, and he wanted to remain anonymous. And so people have different comfort levels, and
Exactly.
you can be out there every day, like myself and Don. You can be kind of in between, where you do want to be interviewed, but up here off camera. And you may just be completely anonymous and not get online at all, or use another identity.
Right.
So there's no right or wrong answer, although I think we're advancing towards a more authentic profile for someone to be online. So kind of moving in that direction. But for the patients, you know, they deserve every right to be anonymous.
As I always say, knowledge is power.
That's right. And this is Dan and Don signing off. Very good question, by the way, from theclinicaltrialsguru.com. Thank you.